All right. Well, I wanted to say hello to everybody. I'm Chris Kane, Executive Director here at CPWR, the Center for Construction Research and Training. I'd like to welcome you to today's webinar, Developing a Heat Illness Prevention Program in Construction. Thank you for joining us. Like all of our webinars, this webinar is being recorded and will be posted on cpwr.com and shared in a follow-up email with everyone who registered. Today's webinar is primarily a discussion-based panel, and we will be using questions submitted during the registration to guide that discussion. Before I introduce our panelists, I want to highlight some findings from a 2023 Dodge Construction Network report that CPWR published on safety management in the construction industry. It's part of a series of surveys that we do every 2 years or so in partnership with Dodge. And this survey found that many contractors are taking the threat of increased heat exposure seriously. Nearly 1 in 5 companies reported that they had had a staff member suffer from a heat-related illness or injuries in the last 3 years. It's clearly an area of concern, and in fact, over half of the contractors surveyed stated that their company has made changes in the last 3 years to help prevent these incidents. Unfortunately, 1/3 still did not have a written heat safety program. And while the use of water, rest, and shade is nearly ubiquitous, most of other methods, such as scheduling work for cooler times of the day, using personal protective equipment, or having an emergency response plan, were used by less than half of the contractors, and only 10% said they conducted physical monitoring to identify workers in distress. So clearly there's a lot more to be done, and for that reason, we applaud all of you who are here today. And now I'm pleased to introduce today's panelists. We will be hearing a brief presentation from Ryan Paparilio, Safety and Health Specialist with the Laborers Health and Safety Fund of North America, and Gavin West, CPWR's Director of Health Research. Then we'll go right into discussion, where we'll be joined by Kathleen Dobson, Safety Director, Alberici Constructors, and Dr. John Williams, a research physiologist with the National Personal Protective Technology Lab at NIOSH. Ryan, I will hand it over to you if you would like to go ahead and share your slides.
Yes, thank you. Can everyone see my screen?
We can. We're looking at the presenter view.
Okay, gotcha. Is that better?
That's good.
Okay, perfect. Thank you. So hello, everyone. I'd like to start off by saying thank you to the CPWR team for inviting us to speak about such an important topic. This webinar could not come at a more important time. Sorry, I'm actually just moving. Okay, there we go. Millions of people, including workers, are facing extremely high temperatures coast to coast. Today's heat waves are hotter, more frequent, and longer than before. So heat is obviously a problem. High temperatures can affect workers in many ways, both long and short term. Not only can workers experience heat-related illnesses, but also face long-term effects. Heat in general is costing everyone money in some way, shape, or form. Decreased productivity, increased absenteeism and incidents, regulatory compliance, and in severe cases, healthcare costs are some examples. Signs and symptoms are overlooked for many different reasons, such as stress, tiredness, or lack of fitness. However, it's critical to train workers and supervisors to recognize these signs early and take immediate action. Workers outdoors and indoors are exposed to heat through many different ways, including poor ventilation, radiant heat, personal protective equipment use, and many others. Heat-related illnesses are preventable. However, with rising temperatures across various industries, there's been an increase in incidents and fatalities. So here's a few fast facts I've thrown in here. Heat is the leading weather-related killer, more than hurricanes, floods, tornadoes, and lightning combined, which is very surprising. Extreme hot weather strains the heart and lungs, causing heart attacks, strokes, and respiratory diseases. The EPA estimates that heat-related deaths can increase by 3,500 to 27,000 deaths per year by mid-century. here's some types of heat illnesses. As you work your way down this list, the worse the illnesses are. Common symptoms of these include confusion, headache, dizziness, and nausea, but any and all symptoms must be taken seriously. So as you work down these heat rash, heat cramps, heat exhaustion, heat stroke, everything that is recorded to any supervisor or whatever the case is should be taken seriously. So obviously we know it's hot. We wouldn't be here if it wasn't, right? But we do have intense working conditions. Our workers, our members, wherever you're at in the country, wherever you're seeing this from, it's hot, and we do, a lot of our workers and members are in very intense working conditions. So we do have best practices to protect workers. So water, rest, and shade, it's pretty easy to implement, pretty simple, but the rule of thumb with hydration is to drink 8 ounces of water 3 to 4 times an hour, and don't wait until you're thirsty. It's best to refrain from alcohol or energy drinks. The length and frequency of rest breaks increases as the temperature rises, so breaks should take place in a shaded and cool area. Having an effective acclimatization plan is also key. So 50 to 70% of heat-related fatalities occur during the first week of work because workers are not acclimatized to the heat. So that's that's always one of the stats that really stuck out to me, is if we could put an effective acclimatization plan in place, we could really help workers really acclimatize to the heat and have a more longer work, stay working as long as they can. A heat illness prevention plan is best when customized, and that's why we're here. A plan should be tailored to an organization's processes, environments, and workers involved. So I do have some others listed here. Obviously a written plan is important, but a buddy system. So sometimes workers are, they might be alone, or they might be working with 1 or 2 other people. If those workers are trained in symptoms, to recognize symptoms, they can actually point out to other workers that, hey, you might not be looking too well, or you might be dizzy or confused, and they can, relay that on to their supervisor. Hazard assessments and prevention and an emergency response plan also helps as well. So these are existing heat stress standards guidance. We do have active state standards in California, Oregon, and Washington State, which are the most protective heat standards in the nation because of their water, rest, shade, acclimatization, and written plan requirements. We do have one in Minnesota, which only applies to indoor only. Colorado has agriculture workers, and Maryland and Nevada are also proposed. We do have a consensus standard, the ANSI ASSP 81050, heat stress management in construction and demolition operations, which just came out recently. And under federal OSHA, which are extremely busy right now, we do have a heat illness prevention standard, which is currently in the works. Until the rule is released, though, OSHA can cite employers under the general duty clause, which if only all 4 conditions of the general duty clause are met. A national emphasis program of the NEP on heat inspections, especially in high-risk industries, which ends April 2025. And if you're an employer and you're not in a state with active state standards, you can actually look at the NEP, and it gives you a really good blueprint or a really good outline of what a heat illness prevention plan would look like. There's also the hazard alerts and materials that OSHA and other entities do put out. Under the National Advisory Committee on Occupational Safety and Health, there is the Heat Illness Prevention Work Group. And under OSHA's Advisory Committee on Construction Safety and Health, we've had discussions on heat as well. So there's a lot of federal and a lot of regulatory work going on. Although there isn't a rule right now, it's definitely in the works, especially with the NEP coming to an end. And a lot of people know what November is going to be. We're really, OSHA is really trying to push to get this roll out, but a lot of states are taking it on themselves to do it as well. So with that, I do want to thank you for giving me the opportunity to give this presentation, and I'll hand it back to Chris.
All right, Gavin, you're up.
Thank you. Thanks, Ryan. And let's see, are people seeing my screen now?
It's not in presentation view.
There we go.
There, now it is.
All right, thank you, Ryan. So I'm not going to speak for very much longer, but I just want to cover a bit more background information before we begin the Q&A portion of the webinar. So I'd like to talk a little bit about key terminology, a bit more information on the adverse effects of heat stress, and then highlight a couple of CPWR resources in particular. So here are two definitions which I sometimes see these confused or used interchangeably, which is why I wanted to highlight these. And these definitions are taken from the glossary of the NIOSH criteria for a recommended standard for occupational exposure to heat and hot environments. And I've put in bold kind of the key part of the definition, which for heat stress, it refers to the net heat load to which a worker is exposed. And that considers metabolic heat generated by the body during physical exercise, environmental factors, as well as clothing worn. And all of that contributes to the body storing heat. And heat strain is the physiological response to the heat load. And that can be external or internal. And that's basically the body's attempt to thermoregulate. And so through increasing heat loss to the environment, that can be through sweating, pumping more blood to the skin. And so those are just kind of two terms that you'll hear throughout the presentation. When we say stress, we think of the stressor, something that's acting on us. The strain is how we respond to that stressor. So heat stroke is a medical emergency. It results in death or permanent disability if you do not have rapid recognition as well as treatment. And so time is really of the essence when you're dealing with this type of illness. And I also like to point out, and this is the NIOSH criteria document talks about this, that sweating differs for classic versus exertional heat stroke. And exertional heat stroke is what is more commonly seen in workers. And so that's an important point in terms of recognizing signs and symptoms. And really change in mental status, for example, confusion or delirium, is really the best way and a real hallmark of heat stroke and a way to differentiate it from milder forms of heat-related illness. This is an infographic showing the burden in the construction industry. Construction workers really have a disproportionate risk of heat-related deaths. And so CPWR had published a study, which I was a part of with our data center, looking at a number of years from 1992 to 2016. This was a little bit more updated data, but it tells a similar story. So this was in 2020. Construction workers accounted for about 7% of the US workforce, but you can see over a third of heat-related deaths. And this is something that's harder to quantify, but there's the human toll. And I thought this was shared with me by a colleague. NPR aired a story this week about two brothers who worked as roofers in Florida. And one of the brothers sadly died. And his surviving brother kind of spoke about his experience working in the heat as a roofer, what it was like to lose his brother who he worked alongside of. And here's a quote. I won't read it. I'll just leave it up for a minute for you to read. So, and you can read it or you can listen to it. And I felt it was very powerful to listen to this person talking about his experiences. Research shows that heat exposure can also exacerbate or trigger a wide range of health conditions. So they're listed on the slide. We see adverse cardiovascular outcomes, as well as things like chronic obstructive pulmonary disease, respiratory tract infections, even hyperglycemia, kidney failure. And I don't think this is one that a lot of people think of in terms of neuropsychiatric disorders. Even serious ones like suicide. And we also have things like adverse birth outcomes with preterm delivery, low birth weight for gestational age. And a lot of these data come from some of these studies that look at hospital admissions and emergency room visits on days when you have extreme heat, and you see increases in the incidences of these types of events relative to baseline. Studies are also investigating heat exposure as a potential contributor to chronic kidney disease of unknown etiology. And so it's hypothesized that this could be, by some researchers, that it's this kind of repeated acute kidney injury that is associated with chronic heat stress and dehydration. But there's some very interesting ongoing research on this topic. And I don't have a construction worker shown here because a lot of this work has been done in some of the hottest regions of the world, looking at agricultural workers and in particular sugarcane workers. Hotter temperatures are also associated with an increased likelihood of workplace injuries. So this is from a study of workers' comp data in the state of California, where they estimated that hotter temperatures were responsible for 20,000 traumatic injuries per year, for example, falls. And they found that one day above 100 degrees Fahrenheit leads to a 10 to 15% increase in same-day injury risk. One of my colleagues attended a Workers' Compensation Research Institute conference recently and shared some work out of Washington State, where they're also looking at workers' comp data in their state and finding similar trends that they're looking to publish, or similar results, I should say. Productivity, which Ryan mentioned, productivity losses due to heat stress cost the U.S. economy an estimated $98 billion annually. So, you know, there's really a lot of benefits to protecting workers from the heat. It's the right thing to do, but you know, it can also make the work more productive by trying to manage heat stress effectively. And so CPWR has a collection of resources for heat illness prevention. These two were OSHA Alliance products, and they're both checklists. One is a programmatic, and the other is a daily checklist. So here's the programmatic one, and you can see some of the elements here are identifying a competent person to make sure the plan's in place and it's operating as intended. You have hazard analysis and procedures for doing that. And then talks about elements of the plan. Ryan hit on a lot of those. Acclimatization, the importance of that is in its own box there, as well as thinking about trigger conditions for when the plan will be implemented, and training, as well as methods for monitoring environmental risk factors. And emergency response is really critical, because even if you have a good program, you know, not everything is 100% fail-proof all the time. So that's a very important consideration, given that time is of the essence when you do have a heat stroke. And so the other is a daily checklist, and that considers the hierarchy of controls and emergency response after beginning with these questions. And there's more. I'm not showing all the sub-questions here. This checklist is longer than the other, but it basically has whoever's filling this out to go through, look at all the risk factors, you know, taking measurements on site, and then based on that, thinking through moving from the most protective at the top of the hierarchy to the least protective. What types of engineering controls can we use here that's specific to the work we're doing for today? How about administrative controls like the buddy system? And what are we going to do if there is an emergency? So with that, I'm going to stop sharing, and I think we're going to move to the discussion portion.
Great, thank you, Gavin. So yeah, we're going to start to answer questions now. I've noted a couple that have come in over chat and Q&A, and we'll try to get to them. But if you have any, type them in, we'll get to them if we can. So I'll just get started. The first, yeah, there's some here about planning for heat injury prevention programs. And I'll just start with this question for Gavin. Treating first aid symptoms is not a problem. Prevention is the key. When does that prevention start? Is there a temperature or a workload? You're on mute.
Sorry about that. Thank you. I think this is a great question, and the person who asked this question hit on an important point that they said prevention is key. And so I think the time to start is always early. So, you know, training and developing a program before the hot season begins, planning before the project begins, identifying and mitigating risk, you know, on a daily basis, as we showed with that checklist, so that you can respond to changing conditions throughout the day and based on a task. One of my colleagues at CPWR, Dr. Babak Mamarian, has done a lot of good work on pre-task planning process in general, which I think, serves well for heat stress as well. We have these specific checklists. And I think, maybe also part of that question is kind of alludes to trigger levels. And there's research. So one study in particular by Mong and Tustin, Aaron Tustin at the time was with the OSHA medical office, I believe, and they tried to look at a concept that the military developed called the heat death line. And they looked at 14 different publications, about 570 heat-related deaths, and did this meta-analysis. And they found that all these deaths occurred within a temperature range, heat index range of 62 to 137. And almost all of them, the vast majority, occurred when the heat index was over 80 degrees. So mind you, there were deaths that occurred below that range. You have to consider factors like, even if it's not that hot, what's the level of physical exertion? Are they wearing impermeable PPE? So, even if it's not hot, heat-related deaths can still occur. And also, there's milder forms of heat-related illness that can still occur, below those thresholds. So that's just looking at the worst case with death. But that speaks a little bit to the trigger levels, and I think that was one of the considerations, for example, with the California state standard, where they have a trigger level of 80 degrees Fahrenheit for when some of the standards requirements kick in. And California also is very close. I think it was accepted and going through some final review at the state level of their indoor heat standard, which has been in the works for a while. And I think the trigger level there was 82 degrees. And ultimately, it's really safer to err on the side of prevention and work to identify and mitigate these risks sooner than later. And it really is, the answer to this question is variable. There's no, it's hard to come up with something that's ideal for all workplaces. I think regulations by nature kind of have to go in that direction, but in terms of best practices, folks can really try to look very specifically to the work they're doing and the tasks they're doing, what the risks are, and make those decisions in terms of prevention and how we're going to prevent these based on the risks that are specific to their work.
Thanks, Gavin. I wanted to ask a very short question that probably has a really good answer that's not as short as the question, but this one's for Dr. Williams. The question is simple. Why is hydration so important?
Well, hydration is extremely important because, as has been mentioned earlier in some of the presentations, one of the main ways that human beings transfer heat to the environment to maintain a stable core temperature is through sweating, especially when it gets very hot outside. And so what happens then is that as you sweat, that water has to come from someplace. Sweat is mostly water with some electrolytes in it, but it has to come from someplace, and it comes from your store of body water. But mostly that compartment that is drained first is your cardiovascular system. So your blood volume begins to decrease, and as your blood volume decreases, it creates a strain on your cardiovascular system. It's harder and harder for the body to pump oxygenated blood around to the organ systems and all the cells. So one of the ways to offset that is to drink properly. And you start drinking early on. You don't wait until, gee, I'm feeling extremely thirsty, because thirst is really not a good indicator of your hydration status. And so generally the guideline is to drink plain cool water if you're exercising and sweating. Even if you're sweating profusely, just drink plain water if it's under, say, 2 hours of exercise. And after that, it's recommended that you drink a balanced carbohydrate electrolyte sports drink. And I'm not going to mention any names because the government doesn't endorse anything. But in any event, even though you lose some electrolytes in sweat, you don't lose that much in the first hour or so of sweating profusely. and it's generally made up after you eat a pizza or something with a lot of salt in it. So mainly to keep sweating, you have to keep hydrated. And so that's the big thing is that if you're getting dehydrated, you may get to a point where it compromises your cardiovascular function to the point where you stop sweating, and then your core temperature skyrockets and you're in heat stroke. But in order to keep working in a hot environment, as you sweat, and you can sweat 12 liters in an 8-hour period without too much trouble. I've seen papers that say you can sweat up to 3 liters in an hour in extreme cases. So you have to replace that. And as long as you're replacing those fluids, then you can keep on sweating and you reduce the strain on your cardiovascular system.
Great, thank you. If we can circle back to this later, there's a question, real simple, pros and cons of hydration drinks, but don't answer that yet. Let's go to another one that was sent in before. And this one I'm going to ask Ryan and Kathy to react to. Have the presenters trialed any heat stress wearables that proactively warn workers about their hydration levels or other factors?
You know, we haven't had a lot of experience with the wearables. It's primarily the workers themselves who have their app on their phone, or they're using their watches to identify their temperature, their skin temperature, and their pulse rate. But we have evaluated a product, and again, I won't share the name of it, but it non-invasively monitors workers' physiological responses continuously throughout the workday. It's worn generally on the upper arm with a sort of an elastic or a Velcro type of band. And they claim that it provides continuous, accurate core temperature. Not exactly sure how that does, but they're readings that are much more similar to much more invasive devices, which is, checking the gastrointestinal system or the esophageal or rectal systems. And we're looking at some of those devices as valid core temperature monitoring devices, because they can tell you both at rest and during physical activity, and you can use them in hot and cold temperatures. They're looking at not only the core body temperature, but heart rates, the sweat rate, and then activity levels. We've sort of stayed away from them because there's a lot of concern about medical monitoring data. Is this truly medical monitoring and biometric monitoring? There's some, there's sort of a gray area there. A lot of these devices are not FDA regulated. And so if you're actually using these and collecting data, first and foremost, you have to be really concerned with security and confidentiality of the workers, to make certain that the information is retrievable over a long length of time. Somebody might come to you in a couple of years saying, on June 26th, I was really hot and I ended up in the hospital for a few days. That's why you didn't see me at work. That's why I had to quit work. And the workers also have to be accessible. The workers and their representatives have to have access to that, just like they would for medical information under OSHA. But using these devices, you could inadvertently limit somebody's work and pay because you're saying, well, your heart rate is too high, or your core body temperature is too high, even though it's sensed on the skin and somehow it's reading the core body temperature. Ryan, what about you?
Yeah, I want to agree with Kathy on that. We have seen different devices in the field, or heard, especially where we're at in DC. We're kind of, we've talked to different contractors, a lot of members out in the field, and I think we're finding the same, it's kind of the same tone of, well, are we being tracked? And then it's always that conversation of, well, your phone is tracking you anyway. So, but there's a lot of devices out there that, kind of say one size fits all. You know, we're going to measure a few things. We've seen some that are sweat patches that only they're one-time use, invasive, and they only measure hydration. So we've seen those, but really I think it goes down the path of worker privacy and making sure that they are being used for that particular use. So thank you.
Great, thank you, Ryan. I really appreciate that. And just to follow on a similar topic, a question for Gavin is, are you familiar with any biometric devices like the Apple Watch that monitor a person's temperature?
Yes, I think there's a lot out there. I think like Brian and Kathy mentioned, I think one important piece is validating. You know, so Kathy mentioned that some of these claim to accurately measure core body temperature, which is really that's the key metric when you're talking about heat strain in the body and how the body is responding is that internal temperature. And I know there's at least some research out there that show that, you know, some of these measurements, if you're looking at skin temperature, these devices, when people, you know, they can be accurate up to a point, but when people actually start getting hot and their internal body temperature rises, that's when you see larger measurement errors. So, you know, I think there's a lot that's very promising. There's a lot of innovation happening in this area now, and a lot of good work to even develop new metrics. You know, metrics that we don't have now. There are emergent metrics for looking at measuring heat stress and heat strain, and so I think there's a lot of good things that are happening. But you know, understanding how to check if some of these methods and a lot of them will use algorithms to take, you know, things like heart rate and you know, you might be able to plug in other values as well, like your age and weight and things to try to make predictions. And I think, you know, they're getting better. And maybe another message here is that, you know, the perfect shouldn't always be the enemy of the good, right? So we might not be able to get, you know, exactly perfect, but there's issues to using, you know, pills that workers have to ingest to monitor their temperature. That's another way, you know, we're taking rectal temperatures. There's, you know, there's obvious barriers to implementing some of these, you know, highly accurate methods on the job site. So I think, you know, it's good to embrace other potential solutions and to figure out what's really working and what's giving us useful data, and those other factors that we point out in terms of who the data goes to. You know, does it go directly to the workers so that they can kind of self-pace and monitor themselves? Does it go to the employer? And I know that I've spoken with developers of different technologies, and they're definitely aware of these considerations and trying to address those. And so they are thinking about these issues with privacy and workers' concerns.
Absolutely, yes. One question came in beforehand that talked about temperatures inside of office spaces, and I've got this one tagged for John. A question that's also come in is there, and this one I'm springing on you. Is there like an absolute no-go temperature? I'm rephrasing it, of course, on either the temperature thermometer or a widget value for outdoor work. But first, if you can respond to like what about an office space? What's too hot, and is there an actual temperature that the building should close?
Well, it's an interesting question because like so many questions like this, it all depends. I'm assuming that the person is, when they refer to an office space, they're referring to a normally air-conditioned space where people are working at desks at a computer, and so their metabolic workload is very low, kind of like what we're doing right now, not a whole lot of work, just talking. And then I'll also assume that that the HVAC system can't be fixed or corrected within a reasonable amount of time, say 30 minutes or something like that. So what we have to remember is that heat starts affecting people as it starts going up. It isn't, you don't just reach some inflection point and then you start having problems. So people can generally tolerate being in a warm environment without too much decrement in their function. But it's been shown that when you hit about 77 degrees Fahrenheit, there's an increase in the number of accidents or like slips, trips, and falls, or something that would happen in an office environment, not so much an industrial setting where you're moving a forklift or something like that. And then as you get to 80 degrees, it gets worse. But generally speaking, when the office temperature gets to be 80, that's generally recommended as to, okay, if we can't fix this and start the air conditioning going again in a reasonable amount of time, it's time to close the office. Now, you can tolerate 87 degrees, but that's about as much as anybody's going to want to be in for any length of time. But mainly it's errors, people's cognitive ability starts to be affected. And one of the things that happens also is that it becomes, you start losing focus on the job. You're more focused on how uncomfortable you are and not on the task at hand. So it's called time off task. And so for a building like that, in a hot environment where the HVAC goes probably about between 75 and 80, you should start considering getting out of the building, going to a cooler spot if you can. And now it may be that if it's 110 outside and it's 80 in the building, you're better off staying in the building. So that's one of those it depends kind of things. But if you can't move to a cooler area, then you might be better off staying where you are. But for the most part, if you can get out of, and it starts getting to be that warm in the building, and it doesn't look like it's going to get any cooler anytime soon, you start moving people out of there around 80.
And then just to follow on, I know, you're not necessarily prepared for this, but any thoughts on like this idea of a no-go temperature or wet bulb globe temperature reading?
Yeah, I think that the military's used the wet bulb globe temperature for decades in terms of just making decisions as to when they should stop training, because you want to train soldiers, you don't want to just kill everybody from the heat. So even though the soldiers may be working in very hot environments and more hot than they're training in at some point on their mission, you want to at least train them in a relatively safe way. I think that the problem is that not everybody responds to heat in the same way. So I've seen literature where somebody did a study on athletes, professional and long distance runners whose core body temperatures were very close to 42 degrees C. So that would be 40 degrees C is 104. So we're talking 105, 105.5 degrees Fahrenheit. And they stop they stop their activity and they walk away. They're doing just fine because they're acclimatized to functioning at that higher level. But that would kill somebody who was not acclimatized to any heat. It would have killed them long before they hit that. So in military training, you can start to assume that over a few weeks of training in a warm environment, the soldiers or the trainees are going to become more and more acclimatized. So you can't use a WBGT in the same way in the beginning as you should use it after a month of training. But generally speaking, I think WBGTs, when you hit about a WBGT of about, which for those people that don't know, wet bulb globe thermometry or wet bulb globe temperature takes into account the dry air temperature, the humidity, which is the wet globe, the radiant energy coming from whatever source. Usually it's the sun if you're outside, or it could be hot machinery or fire. And then it also is attached to an anemometer to measure wind speed, so you get that convective heat transfer. So if you take all those into consideration, generally I think that the work stops at 87 degrees wet bulb globe temperature, but that could be pushed higher or lower depending on where you are in the training period and basically the responses of your soldiers. If your soldiers are, if half of them are collapsing, throwing up, having severe headaches, maybe it's a good time to kind of stop. So now that also depends on the drill instructor too. So, but
So,
around there would be what I would,
yeah, and I wouldn't translate that as a measure for construction industry.
no.
Wait till half of the people are throwing up. But I
Chris, can I
appreciate you
just,
giving kind of the background on how the military has educated
Mhm.
the rest of us and how they've very much studied it. And it's good to learn from. Kathy?
yeah, I just want to add one thing. Not necessarily in the United States, but we have several projects outside of the country, both in Canada and Mexico. And in Canada, where, normally 87 degrees would be extremely hot, they take into consideration the temperature and the humidity, and they stop work at 40 degrees Celsius, which is, as Dr. Williams said, is 104 degrees, real field temperature. And so the entire project shuts down, whether it's in indoor setting or an outdoor setting at that temperature. It doesn't necessarily mean that in other parts of the country that 104 degrees is going to be the stop for everybody. And certainly in Mexico, when you start the day out at 108, and it just goes up from there. It's tough. It's tough to read, but most of those workers are acclimatized to that temperature.
Great, thank you,
Chris, may I
Kathy.
have just a very quick add-on as well?
Yes.
I have a visual to share that I think is appropriate for this. And can everyone see this? So this is, we mentioned looking to the military, where there's a lot of great work that's been done in terms of managing heat stress risks. This is from another population where high school athletes, there's been a lot of good work in the sports world in terms of managing heat. And this is from North Carolina High School Athletics Association, I believe, and these are these heat guidelines. And so just to give a visual and a side by side here, I thought this was worth sharing. And they do have this suspend practice when you get to 90 above WBGT, which is 125 and up heat index. And then they have these kind of other gradients, kind of like a controlled banding type of.
Great. Yeah, no, thank you. That's helpful. I wanted to shift gears a little bit and talk about the ANSI A1050 standard, the ASSP ANSI A1050 standard. The question that came in was, how can the ANSI A1050 standard be used for implementing an HIP? And I've got down here 3 of you who happen to serve on ANSI A10 and were very involved in writing the ANSI A1050 standard. So Ryan, Kathy, Gavin, Ryan, do you want to chime in first on this one?
Sure, I can jump in. So if people are on this call and don't know or haven't seen the A1050 standard, I definitely recommend going and looking at it. It is a standard that took a lot of work to put together. It took about, I don't know, Gavin, 3 to 4 years. But it was well worth the wait. It definitely came at a very important time. But the standard outlines, measures that companies can adopt to ensure workers receive, adequate rest, water breaks, shade while balancing, operational requirements. So you really can kind of balance both in the standard. It also suggests implementing engineering and administrative controls, recommendations like, along the lines of utilizing a buddy system. So there's a lot of stuff that's in there that kind of closely aligns to CPWR's checklist or anything that, as a contractor, if you're in a state that doesn't have a active heat or state standards, you can kind of look at that. And it's kind of, like I said, with the NEP, kind of a blueprint that kind of outlines, if you want to go a few extra steps as a contractor to protect workers in the way of a more technical approach, then that would be the way to do it. But like I said, I definitely recommend, if you haven't seen it, definitely go and check it out. Thank you.
And Kathy?
Yeah, thanks. the A1050 standard, it establishes minimum requirements for the prevention of heat illnesses, management of heat stress, and exposures that are encountered during construction and demolition operations. Obviously, as a consensus standard, it is not mandated, but it's really a best practice, and it starts out with the heat stress management program, acclimatization, surveillance on the workplace, self-awareness education, medical surveillance, having a first aid plan in place, making sure that the employees are fully participating, implementing some heat stress controls. Um, it assigns the responsibility to an administrator, and the process is really very comprehensive. There's a lot of what they call non-mandatory appendices, even though the whole standard is really non-mandatory, according to OSHA. But it's an amazingly well-developed document that only took 4 years because it was written from scratch. When we met at the A10 committee meeting, probably about 5 years ago, we said, we need to write a technical report. And they said, no, we need to we need to make this a standard. And Dr. Tom Bobick took it upon himself to take the lead on this. And I think they did a fantastic job with it. Sidebar, total sidebar. ASSP has a presentation tomorrow, which if you pay the cost, you get a copy of the standard along with your fee, in addition to a couple of other standards. So, that's an option too if you really want to learn more about A1050.
Yeah, just to a side note, I asked Jess to post the link to tomorrow's ASSP webinar where they'll be going over the A10.50 standard. And it is a fee for service webinar, just to disclose that, but that's how ASSP stays in business, by being a standards organization. So if you're interested, the link is in the chat. And just another sidebar, there is so much good information being posted in the chat by webinar participants. Probably half of them could be up here on this panel. So Jessica is pulling everything from the chat, and we'll share these resources in the post webinar email that she sends out once the recording is up. But yeah, I think there's a couple posts about the webinar in the chat. So if you're interested in A1050, it's a good opportunity to dive right in. And Kathy, did you say they get a copy of the standard with their webinar registration?
Yes, they get a copy of the A1050 standard, and there's also a couple of others, either standards or technical reports, that they're going to be provided with also. Great.
And Gavin, did you want to add anything on A1050?
I don't think so. I think Ryan and Kathy covered that really well.
All right, great. I'm gonna go to John. Risk factors, there's a lot of workers in construction who wear clothes that are not necessarily cool, and personal protective equipment that's needed on the job. So how does that impact their heat exposure?
Well, any increase in the layer of clothing is going to increase or trap their body heat a little bit more. It depends on what its vapor transfer characteristics are. For PPE, if you're wearing PPE on the job, it's generally mandatory. It's not negotiable. You have to wear it. But then the PPE, especially if it's encapsulating in some way, it's going to trap all the means of getting rid of that the body uses for getting rid of body heat. So basically, there are 4 main ways to get rid of body heat. One is conduction, where you put your hand on a cold object and heat goes directly from your hand to the cold object. The other is convection, which is air movement across your skin that takes body heat away. The other is radiation. We directly radiate heat out of our body. And that's what people can see when you turn a infrared camera on somebody and see all these different hot spots on them and so forth. And then of course there's sweat evaporation, which we talked about a little bit earlier, which is the most, in human beings, is the most efficient way of getting rid of body heat. Well, if you're encapsulated, or if you're wearing if you're wearing a safety vest, if you're wearing a hard hat, you're wearing gloves, you're wearing a denim shirt, long pants and boots, you're covering up and blocking those routes of transfer of body heat to the environment. And if you add to that hard work, so you're swinging a hammer, you're doing roofing, anything like that, using a saw, anything like that, especially if you're in direct sunlight. And of course, if you're a roofer, you have a real big opportunity for working in direct sunlight. You're simply taking on a lot of heat and from the outside, and you're generating heat on the inside because of metabolic sources. So if you're wearing clothing, especially heavier protective clothing, that is just going to slow down, if not completely block, those routes of transfer of heat out of your body, and you're running the risk of having an increase in core temperature, storing body heat rather than getting rid of it. And then, of course, if you're sweating and that sweating is futile, you're just getting soaked, but it's not evaporating, and that wet water on your body is also kind of an insulator. So I think that that's what people need to be aware of, is if you're wearing any kind of protective gear, and it doesn't really have to be encapsulating like firefighter gear, hazmat gear, or something like that. It can just be wearing a couple of layers. So you have a shirt on, maybe you have a light jacket and a reflective vest, a helmet, gloves, all that kind of stuff. That's going to slow the release of body heat to the environment, and that's going to increase your chances of getting a heat injury. So it's really important to take a break, and maybe, if you can, in a safe area, doff some of that clothing, because that's the fifth way that people control body heat, and that's behavioral. So you're wearing that jacket or that vest that's making you hot, you open it up and maybe all that sweat starts to evaporate, or at least you can, have a little breeze come in there and start to cool you off a little bit. But oftentimes that opportunity doesn't arise for a long time because you're under pressure to get the job done. So that's what happens when you're wearing PPE or fairly heavy clothing that doesn't wick moisture very well, and therefore traps body heat.
Thanks, John. And I think just segueing from that to some employer responsibilities, and I'm gonna kind of poke at Kathy on this, as you are an employer. So there's a couple, John raised the issue of perhaps having to take off some personal protective equipment to cool down. Obviously, you need rest breaks in extreme heat. Water's needed on site. So there's two questions related to employment type issues that came in before the webinar. One is, who's responsible for providing water on a multi-employer job site? And then what about the breaks? Can an employer dock a worker if they take a break because of the heat? Or how does some employers are counting that as lost time. How do employers approach this in the best way, knowing that we don't have a regulation right now that's forcing it in most states?
Well, I'll address the second question first. If you work for an employer who is docking you because you have to take a break because it's too hot, you're probably working for the wrong employer. That's just a personal opinion. That's a Kathy opinion. But we make it very clear to our workforce, whether we're the general contractor or whether we're a subcontractor working for another contractor, that if anybody feels that they need to take a break, go get some water, go into a cool down shack or whatever, they can go ahead and do that. And we also at certain temperature breaks, we extend the break out. And we've gone to, you working for 30 minutes and then you take a 30-minute break, and that's managed by the craft supervision, and the workers themselves. You know, if somebody tries to go back to work after 30 minutes, they're like, hey, come on, let's get the full break in, before we go back and start swinging that hammer and that sledge and really beating our bodies down. At that point, a lot of contractors will say, you know what? We're taking so much time walking from the work area to the break area and then back to the break area that we're going to stop work for the day. And really there should be enough float in schedules to say we can do that, whether it's because of bad weather, whether it's because of temperature, or cold condition, hot or cold conditions, whatever. If you don't plan the work, you're not going to get the plan, but docking workers at break, I would go straight to your union and straight to your representatives and straight to your or your human resource team if you don't have a union to back you up. On the other question about water, it sort of all depends, you know, if usually it's the prime contractor or the general contractor who takes general conditions on the project, you know, whether it's site logistics, sanitation, cleanup, snow removal, whatever. And so a lot of times the general contractor will provide water. On one of my bigger projects, we provide all of the ice in, you know, in the, you know, like the same kind of containers, like you go to the gas station, you grab the 7 or 20 pound bag of ice, as much as you want. They get filled up in several different locations a couple of times a day. And then it's up to the trade partner or the subcontractor to provide water for their workers. In other situations, the general contractor provides all the water, and right now we're going much more heavily, instead of the, you know, the 5-gallon orange containers with the spigots and the little paper cups. We're going to bottled water, which is more expensive, not as environmentally friendly, but it's more sanitary. That's, by the way, included in the A10 standard for sanitation. But realistically, read the contract and make sure that it's agreed upon before the work gets started, because, you know, during the bid process and the RFIs, who does what, who provides water should be discussed and agreed upon. That way the cost can be included in the bid to the contractor, and there's no question. It's clear and evident who the responsibility is, and OSHA will then could take a look at it as to, you know, multi-employers. What really are you? Are you a creating employer, an exposing employer, correcting, or are you the controlling employer? And sometimes they overlap. You know, you can both be exposing and correcting, or controlling and creating at the same time. So, you know, look at your roles and responsibilities, communicate well, make sure that you're following regulations, and implement your safety program to say, we're doing water, rest, and shade. I mean, really, that is the bottom line. If this standard doesn't go through, if you do that, you've made a good start.
Thanks, Kathy. And you mentioned the standard. This standard, I'm gonna wrap up with this question. We're at the top of the hour. We're gonna go just a couple minutes over. But really, what's going on at OSHA? What are they considering? Will OSHA consider using the heat index? Where is that standard that we've been hearing about from OSHA? And I would go to Ryan and Gav, who probably know a little bit about it. Ryan, can you hear me?
There you go. Yep.
Okay.
Yep. Gavin, you want to go, or you want me to jump in?
Could you, I missed part of that question. Could you repeat the question, Chris?
Well, the question specifically that came in is, you know, will OSHA consider using heat index rather than just temperature? So I've expanded the question to, do you guys know where we are in the OSHA rulemaking process? And you can let people know. I know where we are. I know Kathy does. She serves on a federal advisory committee. Ryan does along with me. But just to share the information, because there's some things that are coming in through the chat, and there's some people who this is so important to, who've lost loved ones. Here in this webinar, we've got an opportunity coming up, we hope. So where are we in the OSHA rulemaking process? What do we know about it?
So the first part, we don't know uh, what they will do. So that to answer that, the rule is not public at this point, but they do have a proposed rule that is currently under review by the Office of Management and Budget and the OIRA, Office of in
It's
what
not a
is-
test.
Okay.
OMBOIRA is good.
Okay. I was trying to think of the I there, but yeah, so there is a rule that is at the White House under review, and hopefully we'll find out soon what is in the rule.
Yeah, I can agree to that. We don't know, but because we sit on ACOSH, we sit on the Advisory Committee for Construction Safety and Health, and OSHA has come to us during one of their kind of emergency meetings, and one of their big things was heat. And they came to us and asked us about, what is your take on it? What do you think we should do with some of the things that they're thinking of? And we gave them the best feedback that we could. So really, it's the ball's in their court, and now it's on the way to the White House, and now we're just waiting. But there's a lot of questions that are open ended. But like I said, we're in this year where it's going to be an election year. There's a lot of open ended questions as well. So we're hoping that's going to come out, because this is the time.
And
Yeah.
Kathy, did you want to say something before I wrap up?
I just want to say just a couple of things, serving on the NACOSH committee for the heat illness and injury prevention task force along with Gavin. We looked at all of the OSHA materials and we vetted that and said, this is old and outdated. We went through the content, but then the committee also looked at what would be the best thing in the regulations. We did that a year ago, the end of June, just about this time of the year. It went immediately to the SABREVA panel, the small business groups who took a look at it, made a lot of questions and comments. As everyone said, now it's at the Office of Management and Budget. We don't know what OSHA has put into that language. I would assume, and I may be way off base, I would assume that they would go with the most stringent, which would be heat index. But they're taking into consideration a lot of resources, and I do want to commend ACOSH for, and I think that committee was one that really made OSHA push for the standard to move to Office of Management and Budget by saying, do it expeditiously. Do it right now. And I think that was really key.
Yeah, and I'll just wrap up, is we're really looking forward to seeing what OSHA proposes. The proposed rule will come out as soon as the White House OMBOIRA releases it back to the agency. And then the rulemaking process will continue, and the final rule is going to look different, but the proposed rule will put us all on notice and have us understand what they're looking to do, in a perfect world in the final rule. So stay tuned, but it's also an opportunity for absolutely everyone in the construction industry and any industry to weigh in on what OSHA proposes. So watch OSHA and learn how to get your comments in during the rulemaking phase, because they need to hear from you in Texas who lost your brother to heat, and they need to hear from contractors who do it right, and they need to hear from doctors and researchers and everybody else. So thank you so much for tuning in today. We really appreciate your attendance and your staying with us a little bit over time. I hope you have a great afternoon and keep our workers safe. Thank you.